Should puppies be put on behavior meds? I'm Gabrielle Johnson. I'm a certified dog behavior consultant specializing in aggressive behavior and nervous system dysregulation. So when I see puppies, it is because they are not developing normally. Nervous system dysregulation might refer to things such as anxiety disorders, trauma, chronic stress, hyper or hypoarousal. If you picture a stress scale, green, which is a good level of stress hormones, yellow, where we're starting to see that arousal is high enough that the thinking brain, the parasympathetic nervous system aren't working as efficiently because resources have sort of started going to the sympathetic nervous system. Think of like the limbic system. A high yellow, orange, where we're starting to see a physiological response to stress, more of the body's resources are going towards a fight or flight, or in the red zone, where we're seeing fight, flight, fawn, or fidget, or freeze. And those are toxic levels of stress. They are adaptable when there's a real threat, but when there's not a real threat and the nervous system is perceiving and behaving as though there is a real threat multiple times a day, multiple times a week, chronically, that's really bad for the puppy's behavioral health, but also their mental health, their emotional health, and their physical health. So dogs with dysregulated nervous systems are often set at a higher baseline of stress. Their baseline might be more in the yellow versus a healthy nervous system that's going to baseline in that green. These dogs tend to struggle to come back down from stress events, and they struggle to come back down on their own. They often need a lot of support to do so. And so the goal of behavior therapy is to help them kind of reset to green, to bounce back from stress faster because stress is going to happen, and to empower them with the skills that they need to cope so that the humans can reduce their management and be less involved in the dog's ability to regulate themselves. So that's the goal of behavior therapy. That's also the goal of behavior medication. Now, there are two groups of behavior medication. There's like your maintenance medications. That's what I'm talking about. These meds usually take 4 to 8 weeks to take effect. They're taken daily. They should not be sedating. And they work to complete those three goals in a complement with behavior therapy. Event medication is medication that kicks in a few hours. It is meant to be sedating, and then it wears off in a few hours. And that's used for situational anxieties like going to the vet or fireworks or car rides. Sometimes dogs with dysregulated nervous systems will be on regular event meds around the clock. These dogs are not being sedated by the medication. Their nervous system is so active that it's just kind of helping them get closer to that green baseline. And this might be while we wait for the daily medication to kick in, especially if the dog is in crisis and the family is in crisis. Or they might be used even after that while we work on behavior therapy, depending on the case. The goal is to help the dog behaviorally, but also physically, mentally, and emotionally be in a more stable place. Chronically high stress levels can lead to everything from allergies to cancer. So this really is a medical health issue. It's frustrating to me to hear people boil it down to like, oh, you just want to sedate your dog. Oh, you just want to take the easy way out. This is about the dog's physical health as well as, as much as or more than it's about like convenience for people. I also want to elaborate a little bit on what in crisis means. So I will sometimes work with families where the dog is getting, they are sleep deprived. I've worked with puppies who are getting 8 hours or less of sleep per 24 hours. For context, we want 18 to 20 hours through adolescence. And so these are sleep deprived dogs. The family's not sleeping. We might be having multiple incidents of aggression each day. The dog might be pacing and restless and unable to settle when they are awake, and this is constant. And this is despite management. This is despite environmental management. This is despite trying to satiate the dog's needs. Often satiating the dog's needs are very, very difficult because the dog is so stressed by everything that trying to go outside of the house or even just being inside of the house or, they're too aroused to do calming enrichment or like nose work or those sorts of things. And activities like fetch and flirt pole just ramp them up even higher. They may not be eating. Or they might be hyper-focused on food and, scavenging and scouring the house for food as a coping method, and they might continue that on walks, and they're getting blockages. So when we're in crisis, that's what I'm referring to. So going back to the original question of should puppies be on behavior meds? So if I'm working with a puppy, it is because they are experiencing nervous system dysregulation. It means that they are showing abnormal behaviors, fear responses, anxiety. Their behavior is off. It is not the species typical behavior we would expect to see for an animal of that age. And a lot of folks will say, and I love the concern, I think the concern is very appropriate, they'll say, I'm worried about the behavior meds changing the dog's development. This is such a sensitive time. And they're absolutely right. This is such a sensitive time. The trick is we want to change the development of this dog's brain and nervous system because it's not developing normally and it's not going anywhere good. These dogs are suffering. It is very hard to live with a nervous system that's constantly set to threat. It's very hard to be chronically sleep deprived for anyone of any species, but especially a baby puppy. And up through adolescence, puppies are especially vulnerable to the impacts of toxic stress in the same way that a child is going to be especially sensitive to the impacts of chronic stress. They are more likely to be traumatized. They are more likely to have brain damage. So early intervention is really key. If we are noticing behavior in puppies that is atypical, I'm talking like I've had 8-week-old puppies who bit their people at a level 3 on the way home from a breeder. I'm talking about 4-month-old puppies who are terrified of everything around them. I'm talking about 8-month-old puppies who are getting 7-8 hours of sleep per 24 and engaging in family-directed aggression and resource guarding. I'm talking about puppies where anything you do sets off a mouthing, vocalizing stress response. We want to change the way that these brains and nervous systems are developing. When we see these behaviors in an older dog, a dog who has come out of those puppy stages, and even by adolescence, a lot of that developing has already happened. Although there's still a lot of development. When we're seeing these behaviors, we're talking about we don't cure aggression, we don't cure anxiety disorders, we don't cure trauma. What we're doing is reducing the stress response, empowering the dog with coping skills, increasing resilience, and there's a myriad of ways that we do that, but those are the top 3 goals. We're making life better, we're improving well-being, we are not disappearing the anxiety. But with little puppies, sometimes we can, because they are so early in that development. But it's through behavior meds, combined with behavior therapy, absolutely. But I have seen cases where we have intervened at 8 weeks, 10 weeks, 4 months with behavior meds and seen those dogs grow up to be normal. And that is not something I would expect to see when we're intervening when the dog is in adolescence or when we're intervening with an adult dog. So should puppies take behavior meds? If warranted, absolutely, they should be a first line of defense. This is a conversation to have with a veterinary behaviorist. A board certified veterinary behaviorist is ideal. Or with a general practitioner who specializes in behavior. Often fear-free clinics can be a good place to look for such vets, but it's important to really talk with them and make sure that everyone is on the same page in terms of priorities and in terms of education and knowledge around species typical behaviors, developmentally appropriate behaviors, and what is and is not normal. One of the things that I hate more than anything is when I have a client who is dealing with this dysregulation in their puppy, and no one gets a puppy expecting these issues, right? This is not what people have in mind when they bring home a puppy. And they'll just be surrounded by people, friends, families, the breeders, perhaps their vet, other pet professionals telling them, oh, well, puppies are hard. Puppies are hard. This is what you signed up for. And it's not helpful. It's not helpful and it's not true. Behavior meds are always considered a first line of defense for dogs with dysregulated nervous systems. That should be something we should be investigating at the beginning of the behavior therapy journey. It is going to help the dog. If we are dealing with a dysregulated nervous system, this is a physical issue. This is not just a training issue. And that's why we don't use training in the traditional sense, to address nervous system dysregulation. We use behavior therapy. But with little puppies, the clock is ticking because there is a chance to intervene in a way that we will not get again later on. And there's no guarantee that intervening early will yield a normal dog, quote unquote normal dog, typical dog, something more in line with what we would expect to see of the species at that developmental time. But it really increases the odds. That's just not something that we talk about doing. We don't talk about curing anxiety in dogs that are older. And by older, I mean like by adolescence. So yes, when warranted, puppies should absolutely be on behavior meds because it can quite literally be life-saving.